Hi, this is Dr. Rashmi Shetty. I am a practicing endodontist and aesthetic dentist at Chisel Dental Clinic, Koramangala, Bengaluru. How long does tooth whitening last? Is it permanent? Definitely not. But can we make it last for at least a year, 2 years, 3 years? That depends on how we maintain immediately post we finish the treatment. Once we do a tooth whitening procedure, the first 48 hours are quite critical. Once we do a whitening, how long does it last? Can there be a selection of these whitening agents wherein we can decide which one we want to go for? Definitely yes. Few tooth whitening agents would last probably a little time if the concentration of the agent is a little less in them. Now you have the latest one like laser tooth whitening that enhance your shades by 8 times or more, which are definitely more longer lasting. And they also have at-home agents for follow-up maintenance care so that you do not require in-clinic whitening quite often. The first 48 hours post-whitening is quite critical, and that maintenance has to be religiously followed, all the instructions that are given by your dentist. Now these common instructions that we give to all the patients are that don't have anything colored. White is the go-to. Anything colored can be your tea, coffee, your carbonated drinks, even your turmeric in the food, the palak, things that you don't even think about sometimes can reduce or decrease the results if taken in those first 48 to 72 hours. Post 72 hours, there's a certain amount of stability that comes back because of the saliva that kind of coats the tooth and remineralizes the tooth. In fact, post-whitening, you might feel that the tooth is dry, dehydrated and chalky white, but you will get your gloss back within probably 24 hours of this whitening procedure. Also, you might see certain white spots on the gums immediately post-whitening, which kind of reduce with time. So, if you're having a function or you're planning a whitening procedure for the same, see that you just don't go to the dentist the evening before it. Give yourself at least 24, 48 or 72 hours depending on what you want to eat to plan for the procedure. At the same time, avoid your regularly used mouth rinses as well as your acidic fruit juices. Then what can you have? Mainly stick to again white colored, that is your curd rice or your pasta, bread or something like your idlis that are completely color free. Also avoid milk because it does contain fluoride which kind of interferes with your bleaching process that does happen for the next 24 hours from within the tooth. Some patients do experience sensitivity post whitening, which is a little normal. So nowadays what we do with whitening, we get an ACP gel that is applied immediately post treatment so that the post operative sensitivity is not much with that. But what about your regular bleaching agents if you ask? You will have certain amount of sensitivity which can be easily taken care of by your desensitizing toothpaste, mouth rinses, tooth mousse or remineralizing toothpaste that will be prescribed by your dentist, and use them for at least those first 3 months post-operatively to kind of strengthen the tooth along with maintaining your whitening. After 3 months you do get whitening toothpaste which you can ask your dentist about and continue to use them at least once in the morning or at night to maintain the results long term. Whitening is definitely not a lifetime treatment, it does fade over time, but depending on your expectations of the treatment, you can always discuss with your dentist as to whether you would like to go for laser whitening or you're quite happy with your regular whitening procedures. And also you can ask them about your takeaway night guard kind of bleaching trays with which you can maintain your whitening at home for a long time.